existed. I mean, it is so completely off the map. You literally go outside of Panama City to the end of the road. The road ends, and there's just like a checkpoint. And you think, anyone would think, okay, that's it, that there's nothing else here. Well, in fact, you climb up the hill behind the checkpoint, and there's this settlement, about 300 people, living literally like they did in the Stone Age. I mean, with ranchos and, well, they had some steel pots, but no evidence of sort of modern life at all. And there had been a huge outbreak in that village just recently. And so it's very close to sort of the gateway to the modern economy. I mean, just up the road, an hour north in Panama City, is the tall cruise ships coming from all over the world disgorging their passengers who are going to all the cafes and bistros, which the kids, you know, the young men from these little villages, they all go into Panama City to work in the pizza parlors and the restaurants and things too. So, you know, we think of mosquitoes as the thing you have to avoid. I mean, yes, you need to avoid mosquitoes, but it's people who carry the parasites all over the place. So the challenge of poverty is another huge challenge. But I think the biggest one to me, and the one that really I found just so fascinating, were the cultural challenges. Just this, you know, when I first started working on this book about malaria, I'd go to African countries, and I would go up to people and ask them, have you ever had malaria? I know I have my notebook. And they'd look at you like you asked them, you know, if you had, like you had a third eye or something. I mean, it's literally like going up to a New Yorker and saying, have you ever had a cold? You know, and they're just like, yeah, why are you asking me that? You know, it's so obvious, of course. So anyway, I learned my lesson, and then my question was, when was the last time you had malaria? But even in the malaria clinics that I visited in Africa, I mean, very little is known about how this disease progresses, because it is considered so ordinary. You know, I talked to a bunch of nurses in an African malaria clinic about where do the malaria mosquitoes come from? Where do they bite you? Like, where are they breeding? And they said, oh, in the swamp. You know, and they'd, oh yeah, this is swamps, the wetlands, you know, and that's sort of the insight that Hippocrates had hundreds of years ago. This is a disease of wetlands. Well, in fact, in that particular area, the mosquitoes that carry malaria are breeding in sunny, clear puddles that were right outside their clinic's door. But it's considered such an ordinary disease that people don't, you know, there's not that kind of interest in figuring out the exact whereabouts of this mosquito and where it comes from. But the bigger ramification is that most people who suffer malaria in the world today, they don't rush to the doctor. You know, if you or I thought we had malaria, we'd be at the doctor, you know, we'd be calling our doctor right away. Well, malaria is considered a normal part of life, a normal problem of life. It's considered a mild illness in many places that have a lot of malaria, in part because, and this is something that really is testament to the parasite's great success, is that our body's been able to adapt to the parasite enough so that it doesn't kill us right away. So it can infest us really heavily. It'll take a heavy toll, there's no doubt about it. But in countries where there's a lot of malaria, death from malaria is actually rare. There's just so much malaria that all that tiny fraction of cases that end in death actually add up to this big, huge number. But so that what that means in terms of risk perception is people don't think of it as a highly risky thing, because in their lived experience, most cases come and go and resolve on their own. Maybe they take a few drugs, maybe they don't, you know. It's still debilitating, it's still a huge drain on the economy, but it's sort of like how the cold and flu is for us. I mean, we lose $40 billion a year in this economy from cold and flu. But most of us don't even take the most rudimentary precautionary measures. You know, I mean, most of us hardly even cough into our elbow. You know, we certainly don't wash our hands enough. So, and I think it's really quite similar. And here we are, you know, we're launching this big effort to try to control malaria in Africa today. And it's very exciting, and a lot of things are happening. I can talk more about it. But it's sort of like if a bunch of Kenyan scientists came together and said, you know, you Americans are suffering from cold and flu. It's draining your economy. People are dying. A lot of people die from cold and from flu, and certainly illnesses related, you know, triggered by colds and other viruses, cold viruses and such. You're losing so much money. It's such a huge drain. All you need to do is put this face mask on your children for 6 weeks of the flu season. It's very simple. It's cheap. It's simple. It's effective. You know, we can prove this in clinical trials. Yes, we can do all of those things. But would we do it? I mean, it just doesn't match our social experience of the disease. So that's a huge challenge too. And there was actually an interesting study done by some German epidemiologists that I cite in the book, where they found that, and I might get the numbers a little off, but basically they were looking at how many people who are sick with malaria in Africa go get treated. Get diagnosed and treated, and it's something like maybe less than 20%. So 80%, they're just sick at home. So 20% are going to go to the clinic and actually seek out some help. Well, some other fraction of them are going to get a wrong diagnosis. Another fraction of them are going to get the wrong prescription. Another fraction of them are going to get the right prescription but the wrong dose. And then they followed them and actually posted people at pharmacies to see, do these patients actually fill their prescriptions, and do they fill them correctly? Well, another huge percentage fall off of that. They don't get them filled. And if they do get them filled, they don't take them. So in the end, what they figured out is that out of all the cases of malaria that were occurring in this village where they conducted the study, 3% of people were getting adequate, effective treatment. And if you created a drug that was 100% effective, if you made your drug work even better, you would change that number from 3% to 4%. Because all the other things are the reasons why people are not getting the drugs on time, because they're not seeking out treatment. So that's a huge, huge challenge, and I think it's probably the one that we're dealing with the least. It's easy for us to tackle the technology part of it. We can throw money and try to get a vaccine, and we can get better drugs, and we're really good at distribution. We can blanket Africa with bed nets, and that's what's happening now. So since the late 1990s, malaria really fell off the map for a number of decades after probably the 1960s, 1970s. It just was not talked about, completely neglected. Since 1998, funding for the fight against malaria has gone from $100 million a year to nearly $2 billion a year now. So it's huge, huge amounts of money that are going into malaria today. And it's a really exciting. It's a really exciting time. I think this is a great moment. There's really a lot of momentum to do something about this disease. But that said, there's tremendous challenges too that we need to tackle really head on. And I think the cultural challenge is probably the biggest one that we're not really talking about yet. We like to emphasize the commodities that are cheap and easy and effective. The bed net, the idea is people, we've proven this in clinical trials. You take a bed net, you treat it, you impregnate the material with some insecticide. So you string this over your children and your pregnant women at night. Those are the people who are most vulnerable to getting sick from malaria. And if the mosquito comes and lands on it, their legs will suck up enough insecticide that it'll kill them. And also the insecticide will sort of exude in the air a little bit and repel the mosquitoes so they don't even want to come in and bother that person. And this is 20% effective at reducing mortality in children. So nothing to sneeze at, and very simple, very easy. We can distribute this thing so easily, this item. This isn't like a vaccine that needs refrigeration in a truck and then refrigeration at the clinic and this complicated, this is very simple. This is totally low tech. People can put bed nets on the back of a motorcycle and go anywhere and offload them and distribute them, and we've been doing that. So with this huge push, we've been distributing hundreds of millions of bed nets. And President Bush, who put forward a $1.2 billion initiative to fight malaria a few years back. He said, after he was out of office, he said, this malaria thing is really cool. It's really cool because it's quantifiable. We can count it. We can count how many bed nets we distribute, and we can count how many people get the bed nets. So it was all about this. We need something we can really sink our teeth in, some numbers we can put on our press releases, so, and that we can use in our fundraising. This has become such an important part of the effort. And it makes sense if you think about going back to the social experience of the disease. People don't think it's a big deal in those countries. There's no constituency on the ground to say, please get rid of our malaria. It's not like AIDS in this country where people who are infected with HIV, first of all, they live long enough now, and they can organize, and they have. And